Hi, this is Dr. Praveen Tripathi, and with me is Dr. Aryan, who got ranked 13 in INICET exam. Aryan, first of all, many congratulations.
Good evening, sir. Thanks a lot, sir. Thanks a lot.
So, Aryan, you have been using the Cerebellum app, I believe, for 2 years. We started at Cerebellum event, the quiz event, and since then you have been
Yes,
using.
sir.
Before I talk about the preparation strategies, Aryan, I want everyone to know that in NEET PG you got a rank under 250, and
Yes, sir.
we have a WhatsApp communication. I asked you that give me an interview, and you said that I'm not happy with the rank. I will give you the interview when I get a good rank. So now you're happy.
Yes, sir. Very happy, sir.
ठीक है. चलो Aryan, so in Cerebellum for certain subjects you use live classes, you did the E&Ds extensively, you did the GTs
Yes,
extensively.
sir.
I want to specifically talk about the medicine. You use Dr. Dilip's classes and videos a lot, and medicine is an enigma. I mean, it's very extensive. You don't want to spend too much time on medicine. At the same time, there are so many questions from medicine, you don't want to miss them. So, how did you approach medicine, and why did you use Dilip's videos?
Basically, sir, firstly, this was my third attempt. In
Mm,
my first two attempts of INI, I got a decent rank under 100 only, 79 and 195. But I
mm,
was in a dilemma that medicine can be done from first and second profs.
mm,
It can
mm,
be done up to a
mm,
certain extent. Like
mm,
you can do 50 or 60% of the medicine
mm, mm,
from
mm,
first or second prof knowledge.
mm.
But sometimes core medicine will appear for sure. It
Right.
has to be done from the medicine aspect only. Like in this INI, it was a core medicine paper only.
Mm, mm, mm,
And regarding the Dilip sir lectures, the point which I liked the most was the algorithmic approach. Dilip sir
mm,
has given algorithmic approach of each and everything. Like
mm,
everybody knows us in INI, they love to ask the next step.
mm,
What is the
mm,
next step in this? What is the next step in that?
mm,
What is the management protocol? So Dilip sir
mm,
has given each and
mm,
everything in a
mm,
protocol fashion, in a algorithmic fashion.
mm,
So आपको सोचना ही नहीं पड़ता कि what is the next step, because you have learned in algorithmic fashion, and algorithm is all about next step.
mm,
So
mm.
this is the most important point which I liked about Dilip sir lectures is algorithmic approach of all topics. And Dilip sir has also.
Exactly same thing was told to me by some other student under 50 rank only for surgery. That Dr. Amrit Nasta also
Yes,
follows the exact same approach. He asks you what would be the next step, and then he talks about it.
yes,
You
yes,
have
sir.
the T&Ds of Dr. Amrit Nasta sir also, right? So,
Yes, sir. I have done E&Ds of all subjects
hmm,
because I got improvement in this INA because of the algorithmic approach only. I saw all of the PYQs. Majorly, they are focusing on the next step.
hmm,
If you
hmm,
have in-depth knowledge and
hmm,
you need a protocol, you need an
hmm,
algorithmic approach. It is
hmm.
very extensively covered by Dilip sir in medicine lectures.
Right. Aryan, as far as the test and discussions are concerned, what we call as E&Ds, you extensively
Yes,
use
sir.
E&Ds almost for all the subjects. What is the reason behind
Yes.
it? And how exactly did you get benefited by these E&Ds?
Sir, actually, my reason for being using the E&Ds was I was not able to practice so many questions on
Hmm.
myself. Matlab, I
Hmm.
was not able to do like
On your
100 or
own.
200 questions
Hmm.
daily.
Hmm.
I have to review them. It was a
Hmm.
hectic task for me.
Hmm.
I like to revise content, but I
Hmm.
was not happy with question practice. So I like कि videos देख लो इससे अच्छा है.
Hmm.
उसमें भी तो
Correct.
question ही cover हो रहा है.
सही बात.
E&Ds में तो
Hmm.
75 to 100 questions का E&D रहता है
Hmm.
Cerebellum में. It is
Hmm.
very good,
Hmm.
and you will get a in-depth knowledge of
Hmm.
topics as well.
Hmm.
And major approach is in INI you have to eliminate the options because
Hmm.
they are asking multiple correct nowadays,
Correct.
like
Hmm.
around 50 to 60 questions are multiple correct.
Hmm.
In E&Ds the teacher will tell you how to exclude three options,
Hmm.
how to
Hmm.
exclude two options,
Hmm.
so that you can reach the right answer. That's
Hmm.
where I guess E&Ds helped me a lot.
Hmm.
I was able to eliminate all of the options. Even I think I didn't know the answer of 50 questions in this
Hmm.
INA, but
Hmm.
I was able to reach the correct answer because I was able to eliminate all of the options.
Okay, so
That's where E&D
elimination.
helps.
Yeah. Yeah, we keep talking
Yes.
about the art of solving MCQs, and this is what art means. Uh,
Yes, sir. Yes.
ability to get to the right answer despite not knowing it completely.
Yes, sir.
And you were also using the GTs very extensively. So, what was your
Yes, sir.
experience of using Cerebellum GTs?
GTs basically INI pattern GTs I gave extensively of the cerebellum because I thought they were actually mimicking the actual pattern.
Hmm. Hmm.
Difficulty level was some INI was moderate, some was difficult also.
Hmm.
And the major point I liked about the cerebellum GTs was the video solutions.
Hmm. Hmm. Hmm.
Again, it is mimicking E&D pattern because teachers are again
Hmm.
eliminating the options, and
Hmm.
explanation are crisp. Only 1 to 2 minutes videos are there, so you can wrap up the GT review in 2 to 3 hours.
Yeah.
and you can give the GT in 3 hours. It's only around 6 to 7 hours. You can study also.
Mm,
So
mm.
GTs can be wrapped up in 6 to 7 hours, and they are actually moderate to difficulty level. Now
Mm.
INI level is rising up day by day, and it is more
Correct.
clinical, more
Correct.
clinical. All
Mm,
of the teachers are focusing on clinical aspect only. Even
mm,
if we are
mm,
talking about the short subjects,
mm,
like third prof subjects are the short subjects, they
mm,
are also now a bit
mm.
clinical. They are not
Yeah, yeah,
asking the facts.
yeah, yeah.
In the GTs, cerebellum GTs are covering entire clinical aspect only.
Mm,
So
mm.
that helped me a lot.
Yeah, yeah, yeah. Even when we were thinking about this video explanation idea, the thought was this only, that students take GT, but they don't review it because you are tired
Yes,
and
sir.
you want to spend 9 hours reading about the explanations. So can we do crisp explanations and get the process of review complete in 2 hours? And I think, I mean, I've been talking to, I was talking to Soham rank 20. I'm talking to you, multiple other students who are in top 50, and everyone said the same thing, that that it is serving its purpose.
Initially, sir, I used to take 1.5 day to review the GT. 1.5 day.
Yeah, yeah.
मैं like I was so uh, I was trying to review the GT in
प्रोक्रेस्टिनेशन होता होगा.
4 hours, but
हाँ
it was not happening. हो ही नहीं रहा था.
हाँ
जब वीडियोस
हाँ.
एक्सप्लेनेशन आए तभी ही हो पाया वो पॉसिबल.
राइट, चलो अच्छा है, अच्छा है. आई मीन आई एम हैप्पी टू सी जिस वजह से क्या था एग्जैक्टली वही बात बच्चे बोल रहे हैं. तो इट
यस सर,
इट
यस सर.
ऑल्सो फील किया, चलो ठीक चीज़ हुई.
यस सर.
आर्यन, एक चीज बहुत क्लियर है यार कि द पैटर्न ऑफ एग्जाम इज बिकमिंग वेरी क्लिनिकल एंड टफर. आई मीन
यस
इवन
सर.
द
यस
टॉपिक्स
सर.
आर द सेम, द एग्जामिनर्स आर गोइंग इनटू द डेप्थ. आई मीन गॉन आर द डेज
यस सर.
पुराना चीजों के ऊपर सुपरफिशियली पढ़ के निकाल लो. तो इफ समबडी स्टार्टिंग विद द प्रिपरेशन, व्हाट वुड यू एडवाइस दैट स्टूडेंट?
Initially, sir, if you're starting like in, I started my preparation in internship, starting of
हम्म.
the internship. So you have enough amount of time. Even
हम्म.
if you're starting in third or fourth prof, I would
हम्म.
like to say initially, if you're having any platform, be it
हम्म.
Cerebellum, be it
हम्म.
Marrow, be it Prepletter,
हम्म.
watch initially the main videos,
करेक्ट.
because you'll actually even if you're not building the concept, you'll get to know all of the topics which are actually there
राइट.
in the subject.
सो डेप्थ
Topic
डेप्थ
कोई
जो है
छूटे नहीं.
अपनी, डेप्थ जो है एमबीबीएस में क्रिएट कर लो. डेप्थ बाद में क्रिएट करना माइट नॉट बी दैट इजी. ऑल्दो ऑल्दो
Because it will, yes sir.
ऑल्दो सी द मिशन क्लासेस, द होल आइडिया इज दैट, आई मीन व्हेन वी स्टार्टेड मिशन लाइव क्लासेस द आइडिया वाज कि फॉर एग्जाम गोइंग स्टूडेंट्स इन इंटर्नशिप और पोस्ट इंटर्न, डूइंग मेन वीडियोस में नॉट बी सो इजी, टाइम नहीं है. एट द सेम
Yes
टाइम
sir.
restricting yourself to something like BTR or rapid revision might be a bit lesser, तो in depth नहीं आ
Yes sir.
पाएगा. So how to
Yes sir.
hit the sweet spot बीच में. So that is
Yes
how
sir.
mission classes were started, and a lot of students have used it and passed exam. Wonderful,
Yes
Aryan.
sir.
So it was really nice talking to you. तो अभी क्या प्लान है भाई? रैंक 13 के साथ तो कुछ भी मिल जाएगा, क्या लेने वाले हो?
सर जनरल मेडिसिन ही लेना है सर.
बहुत बढ़िया. मेडिसिन देखो किंग है. आई ऑलवेज से इट इज द किंग सब्जेक्ट. And just because somebody gets a good rank, don't switch to any other specialty like radiology, because medicine
यस
medicine
सर.
होती है.
यस यस सर.
आर्यन, एक रिक्वेस्ट है बेटा, स्टे
यस सर.
इन द टेलीग्राम ग्रुप, कीप गाइडिंग द
ओ.
जूनियर्स, है ना. व्हेन दे,
यस सर. यस सर.
द सीनियर्स जिन्होंने निकाल रखे हैं उनको और कॉन्फिडेंस आता है. एंड वेरी वेरी
यस सर.
हैप्पी टू सी यू सक्सीड एंड मे गॉड ब्लेस यू.
थैंक यू सर. थैंक यू सर.
थैंक यू बेटा. ऑल राइट, बाय बाय.
बाय.